Good day. I am Jasmine Lawrence de Resurreccion, a student nurse from BSN Level 1, Section 1. Today I will be demonstrating two parts of vital signs, which are the pulse rate and respiratory rate taking. But before that, let us tackle what are the purposes of this. So, pulse rate taking, this will serve as a baseline data about the patient's heart's pumping action and the adequacy of the peripheral artery blood flow. While for the respiratory rate, this is the breathing mechanism of the patient. So this includes the input of oxygen and the output of carbon dioxide. So the purpose of this is for the emotional and health balance of the patient. But before that, I will start by taking the pulse rate of the patient and then followed by the respiratory rate of the patient. So first, you will have the assessment. We have to assess the patient's health condition. So if the patient is conscious and if she is able to participate in taking her pulse rate, and we can also check the medical record or the chart of the patient or client. And then next, we have to check the nature of her pulse. So we will be getting the pulse rate in her radial artery. After that, we will now proceed in preparing ourselves and the equipment. So I will start with hand washing or hand hygiene. So this is to prevent cross-contaminations of microorganisms between the nurse and the client. And then after that, we will assemble the equipment. So we only need a wristwatch with second hand for counting of pulsations or respirations. Then first and foremost, we have to identify the client and explain the procedure. So this is to ensure that we are performing the right procedure to the right client, and also in explaining the procedure, this is to alleviate any fear and anxiety that the client may feel, and also to establish rapport between the client and to encourage the client to cooperate. Good afternoon, ma'am. I am Jasmine Lawrence, your student nurse for today. So ma'am, I would like to clarify some of your informations. Is that okay? Okay, ma'am. So may I know what your name is?
Marty Louis P. Agonia.
Okay. Ma'am Marchi Louise. How old are you, ma'am?
12 years old.
Okay. So Ma'am Marchi Louise. Okay. Your surname is Agonias, ma'am, right? And you are 12 years old. Okay, so I would like to know when is your birthday, ma'am?
May 6, 2009.
Okay, May 6, 2009. Okay, so Ma'am Marchi, I will be taking your pulse rate and respiratory rate. So in taking your pulse rate, ma'am, I will just fill in your radial artery located here. Is that okay? And then for your respiratory rate, ma'am, I will just count the number of breathings you have in 1 full minute. Is that okay? Okay, so if you feel any fear right now, rest assured that you will not feel any pain and it will just be a fast procedure. Is that okay again, ma'am? Okay. So now that I've already identified the client and explained the procedure, I will now proceed in taking her pulse rate. Okay, so we have to rest the arm of the client alongside her body with her wrist extended while her palms are face downward. So this position lets the radial artery of the client will be located on the inner part of her wrist. And then after this, we will use our fingertips of the 3 middle fingers of our hand and then locate it inside. Put it under the wrist while your thumb rests above the wrist of the client. And then we will apply pressure, but not too hard and not too light. Because pressing too hard, this will actually prevent the blood in flowing and it will give you pulsations that are not continuous, or it might stop the pulsations. While pressing too light, this will only give you subtle pulsations, or you will not have an accurate count. So pressing it, just normal press and not too hard, not too light, just enough to feel the pulsations. And then we will record the pulsations using a wristwatch. So count the pulsations in 1 full minute. So we have to have a sufficient time in recording the pulsations of the patient so that we will have an adequate result, and it will also give us the enough time in checking the irregularities and abnormalities in the pulse rate of the client. Okay. So after getting the pulse rate of the client, if it is abnormal or below the normal rate of the pulse rate, we have to recount again the pulse rate of the patient to have an accurate rhythm and a rate of the pulse. So in recounting, this is also still necessary if the rate is abnormal. So my patient's pulse rate is normal, so I don't have to recount it again. Now, after getting the pulse rate of the patient, I have to wash hands or do hand hygiene again. So this is for infection control. And after that, we will record the pulse rate of the patient. Okay, so we have to evaluate the nature of pulse. So the rhythm of her pulse is fast, given that her age is 12 years old. So she might have activities before getting her pulse checked. So the normal pulse for teens are 50 to 90. So my patient had 88 per minute. Then after, we have to record this in a graphing sheet. So that's all in taking the pulse rate of the patient. Now I will proceed in taking the respiratory rate of the patient. Now earlier, I've already assessed her medical condition, so she's able. And then she will now kind of proceed in taking her respiratory rate. So I will now also check the nature of her respiration. Okay? And then after, I have already identified the client and already assessed her condition and explained the procedure to her. And now I will be proceeding in hand hygiene again. And also assemble the equipment, and I still have here my wristwatch. Okay, so after this, I will proceed in taking the respiratory rate of the patient. So I've already get the respiratory rate of the patient. So I just hold her wrist as if I was taking her pulse, because so this will also alleviate her consciousness because I am watching her number breathing. And the next, I already assessed or look for the rising and falling of her chest. So one rise, this means rising and falling of her chest. So one inspiration and one expiration is equivalent to one respiration. And then after looking for the chest, I also count the number of respirations using my wristwatch and 1 full minute. So again, we need a sufficient time in recording the rate of the patient. So this is to ensure that we have already an adequate and accurate result. And after that, again, I will proceed in hand washing or hand hygiene rather. So this is also to prevent infectious control and prevent microorganisms to spread. Then after that, I will check her character of respiration. So my client is breathing normally and her rate is normal. So she has 90 respirations in 1 minute. So after character of respiration, I will record also the character of respiration of the client. So this will serve as a baseline data for healthcare providers. So both the pulse rate and respiratory rate will be used for the other healthcare providers. So that's all for today's return demonstration.